Trauma is no accident. There's always a cause and effect to a traumatic episode.
Trauma centers have a number of roles in the community. The primary role is to take care of the injured patients and save lives and get people back to good health. But in addition, we have the responsibility as a trauma center to try to identify why trauma occurs and do everything we can to prevent it.
I need to actually decrease my workload, and that's what a good trauma center does. It decreases the amount of patients that we see in the resuscitation room. And we do this by outreach program. We have a robust seatbelt program, we have a baby seat program, we have a motorcycle program as well. We have a helmet program. We have a alcohol screening, referral, and treatment program, not only here, but we also have it in our outpatient.
A major problem causing injury is drug and alcohol abuse. And people who are alcoholic or drug addicts have a disease that causes injury. And we look upon it as a disease, and we feel that rather than just taking care of their broken arm, we need to take care of all of the diseases, including their underlying problem. And so we screen our patients for drug and alcohol abuse, all of them. And those who have drug and alcohol abuse have an intervention in the hospital and are advised to have treatment as outpatients.
Why is this important? Because in our data that we have here in Ventura County Medical Center, over a third of our patients have alcohol on board. And that's significant. As you know, the alcoholism is a problem not only in this county but in the state, and we're making a very concerted effort to decrease the amount of alcoholism or alcohol-related injuries in this particular county. We've been very successful because the administration as well as behavioral health has embraced this and has bought into this particular type of program.
We've been involved with what's called every 15 minutes, which has to do with teaching juniors and seniors of high schools the responsibility of drinking and driving and the effects they have on their families, themselves, and their friends. So we have a big network of community outreach.
We're all interested in the prevention of injuries, and all of us within our own individual fields are interested in preventing the type of injuries that we see on a daily basis. We see all kinds of things here at VCMC. Motor vehicle accidents are definitely one of the highest number of populations. Also motorcycle patients, we see a lot of motorcycle patients and a lot of patients who are involved in some kind of fun sporting event like riding their bicycles or skateboarding.
We know that falls have now overtaken car crashes as a major cause of death after trauma. We now are leading an effort in the county for a comprehensive fall prevention program to try to minimize the fall injuries. We know the reasons that they happen. People get older, they get debilitated, they have too many medications. We now are able to screen people for their risk factors for falls, many of which are treatable. And so we are initiating a comprehensive program that is going to involve every time a patient comes to the emergency department to get screened for falls. But in addition, have the paramedics screen patients and identify fall risk issues for that patient to take to their primary care doctors.
We're fortunate to have multiple clinics throughout the whole county. We have 30 clinics that are involved in our network. We also have a specific trauma clinic that we follow up our patient. It's important to know that many of our patients are underinsured or non-insured at all. And when you become a trauma patient, it's a perfect opportunity to get you involved in some of the resources that we have. So if you don't have insurance or don't have a primary care physician, the trauma service, when we see you as an outpatient, gets you a primary care physician and get you incorporated into the healthcare system that we have here. We may have a woman that's fallen down the steps. We see her as a trauma patient and find out that she has coronary artery disease and has not sought any help for a coronary artery disease. We would actually put that particular patient with a primary care physician, work her up, and take care of her coronary artery disease or her diabetes that she had that actually probably caused her to fall to begin with. Now she's taken care of, she's safe for her home, and she has a primary care physician that can take care of her throughout her life.
When people leave the hospital, they're not all better. They need follow-up, they need long-term care, they need attention to the psychological and social issues as well as the physical issues. For example, our brain injured patients have access to our neuroscience center, which provides comprehensive long-term brain rehabilitation care. Post-traumatic stress is another very important problem after trauma, and we have resources to help patients deal with this. And we are lucky to have a comprehensive mental health system where patients can obtain long-term care for these important issues as well.
I think the most rewarding part of treating patients is seeing them recover from their injuries and return to the crazy activities that got them in the situation where they became trauma patients.
I want to be there on the day that a child who is very, very, very sick, when they come into the hospital, is able to walk out on crutches or walk out without crutches out of the hospital. To me, that's rewarding. It's the reason I do what I do.
I've been a surgeon for a long time now, and I really enjoy caring for surgical patients, but there's nothing more gratifying than taking a very injured patient who might die and helping get that patient through that process, seeing them heal, recover, deal with the issues surrounding their injuries. That's really being a complete doctor as well as a surgeon, so it's very gratifying to take care of trauma patients.